Hi, happy Motivational Monday. It's the nursing professor here, and I want to talk to you today about another alternative to bedside nursing or acute care nursing. And again, keep in mind, I'm not trying to get people to leave bedside nursing. I am just giving you other options in the event that you want to spread your wings, or you feel that life is life-in and you need a more flexible schedule than bedside nursing can give you. So a utilization review nurse is a nurse who actually acts as a liaison between the insurance company, the patient, and the hospital. So that person needs to have really, really good communication skills. So typically their day is like this. They are given a list of patients that they need to follow up on. They look at who should be discharged today based upon what the insurance company says. And then they take an intricate detailed look at these people to see whether or not they're really stable for discharge or not. If there is some documentation that indicates that they need an additional day or they're not ready for a discharge, then that is the nurse that actually communicates with the nurse at the insurance company to let them know that these are the abnormalities that this person continues to experience and that they're not stable for discharge. And usually the insurance company will grant another day. Now, with that nurse needs to respond very timely, need to be able to juggle quite a few things at one time, because you really want these decisions to be made early in the day so that that person doesn't wait until 5-6 o'clock when insurance companies are closed and you can't get their approval for that hospital stay. All right, so I think the misnomer is that many times people think as long as a person's in the hospital that their days are going to be covered, and that is just no longer the case. The insurance companies typically have a prescribed number of days that they assign to a given diagnosis. And not to say that you can't get additional days, because you certainly can, but this is where the utilization review nurse comes into place, and they're able to tell whatever those alterations are or abnormalities or things that are not following textbook in order to get those additional days approved. So skills that they should have: good communicators. Another way that they should be detectives to look in documentation to pull out things that may be abnormal. Great time management so that they're getting these things done timely and efficiently as possible, especially at the onset of their day versus waiting until the end of their day. It is literally, again, like bringing your skills from the bedside to a paper, because that is the same patient that is in your bed. However, at this point that they are on paper. So where do these utilization review nurses work? They work in acute care hospitals, mental health hospitals, subacute hospitals, and insurance companies. Many insurance companies have multiple utilization review nurses who work to ensure that the insurance company is getting the best bang for their buck. So they work all around cost containment. And so you better bet that if it is likely for your person to be out of the hospital in 3 days, then the insurance company is going to push for that. And so you need someone on the other end, meaning a utilization review nurse in the hospital, who's able to substantiate, document that no, this person doesn't need to go home yet because of all of these abnormalities. Salary is about $90,000 with insurance companies. Many times those nurses make bonuses because they're saving money. Another quantifiable job in healthcare. Typically salaries will be more than that if you're certified, and the certification is a certified case manager. And certifications in any area typically brings you a little bit more money. And so I hope that helps as far as giving you an alternative. Again, not trying to get you away from the bedside, but sometimes life is lifing and you need some other alternatives than maybe the structured 12-hour shift or something like that. So anyway, I'll see you next week where we'll talk about another alternative to acute care nursing. Bye for now.